It's coming out farther than it's concerned. I'd be shocked at some of the things we learned. No, sir, 1 minute.
First time. Keeps me alive. All right. Good afternoon, everybody. Welcome to the Rotary Club of Greater Huntsville. It's great to see all the beautiful people in person and on Zoom today. Bill's going to kick us off with a song, and he wore the bow tie to support the song today. So,
And Chris, this is not a love song.
I'm be disappointed now. Come on.
This is the Tumbled and Tumbleweeds, Bob Nolan, and Sons of Pioneers. Anybody remember the Sons of Pioneers? They had a very good vocalist on there named Roy Rogers. They also had another guy named Ken Curtis. Does anybody know who Ken Curtis is? Festus on Gunsmoke. There you go. So they had quite a bit of talent in that group, but this song, 1930, that's when Chris finished high school. I'm there. You know what fixed?
Physicians and nurses in the community to know all know that our hospitals and our rapid response systems are occurring right now. As Jeff pointed out, we are at certainly at a surging point. Today we have 280.
So I'm not sure if that song was dedicated to my presidency.
That I believe is the highest that we have seen. Substantial impact to hospitals and other healthcare providers' ability to respond to our community promptly is the large number of employees who are.
She's got the remote over here to handle that. All right, please face the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Feel well with me. Dear Heavenly Father, we're thankful for this day. We're thankful for this Rotary Club. We're thankful for our motto, service above self. Help us continue to do that. We pray for our men and women in our military uniforms that guard our freedom. We pray for our first responders, our police departments. Pray for our world leaders. Pray for each family that's represented here today, and help us to stay healthy. Help get rid of the virus. Forgive us where we failed thee, Lord. Give us a good day. We're asking your name. Amen.
Amen. All right, we'll get started here in just a minute.
No, she's having some health issues. Yeah, so I don't think a little bit better.
Are you?
I'm not.
Well, I know she did. She got you. Say how she is.
Hey, it's just maybe, I think she might like that. But you know, I don't want to, you're pissed off at me.
Oh, I know. I know. Yeah, I know. And this is such a weird time with, I mean, yeah, I've recovered from COVID, so.
Yeah.
It's,
It sucks too. I
it's
had it
happening.
last year. A long time ago.
So I had the new variant, so it's not as bad, but it's still not pleasant. Well, you know, I got done, snowed in a couple times, and I had heard a voice, I'm like, something's up.
Yeah, she played her Christmas party.
Successful, right?
Do you understand it?
We're,
And I did get to go to WEC last week, because I was supposed to be on. Did you go there?
But I had a good idea. I was trying to figure out a way to make it. So my office has been with me for some places. And so, I hired somebody across the street. He said, "Let's do that." So, so like, you just don't realize how many little things. It's just,
Yeah.
now I'm basically, like, just teaching Renee how to teach that part. So I just got stuck.
Yeah.
That's happening.
Glad that
I did make a video. I didn't go to any.
He said he thought it was more.
Yeah, I was like, I need to. I really like going. I miss everybody.
Yeah.
That's why I signed up for every intention.
It was too, but.
Can you go put it on that side account, Greg?
Yes. I'll be worried about my kids and grandkids. COVID.
Yeah.
I just told her I just got through with it.
Andy has it. Sarah thinks she has it. And Rose for sure has it.
It's everywhere.
Yeah. The symptoms are all mild.
Yeah, it's much milder than it is.
My biggest worry is Sarah's little youngest, because he has no vaccination.
Yeah. He might not get it. But it is.
All right. You guys go ahead and
And he may have.
continue reading a couple announcements. We got a thank you card from Dr. Carr from last week that spoke to us. Leave that right here when we go. Backstory to that. We'll talk about that one later. We got a really nice card in loving memory of Mary Elizabeth Bates Stanley, March 23rd, 1936 to November 16th, 2021. We know this was a big deal for Thornton and his family. Words cannot express our heartfelt thanks for the sympathy, expression of love and support that you have extended to our family at this time of great loss. Our hearts are saddened, but they are also filled with gratitude for the life and legacy of our wife, mother, and grandmother, and the blessing she was to so many, the Stanley family. So thank you, Thornton. We appreciate that. A lot of us were able to attend the services for Harry per year this week. They were really nice services. Carolyn really appreciated our presence. And I don't know if I scored or not, but he had, he was the pocket knife guy, right? And so he had this bowl of pocket knives. And I wasn't scrounging through the bowl, but there was one pocket knife that on the back of the box said Little Peanut. So I figured that meant something interesting, and I took it and I gave it to my son because his nickname was Peanut when he was growing up. So I don't think Carolyn's on with us today. I don't know if she is or not, but they were great services, and Carolyn, we wish you the best. And if you need anything, let us know. All right, we have some great guests with us today. Obviously, we have our speaker, Jeremy Blair from Wellstone. Jeremy, thanks for being here, and it's awesome to have Karen back in the house. You can come anytime you want to. We miss having you every week. Alex McDowell is here with us again today, the executive director of the Scouts of North America. So thanks for being here, Alex. And Reed, we got him dialed into the memorial cleanup at the end of the month, so you can count on him being there. We're trying to get him to the ramp build too, but we don't want to push it too much. We want him to join the club. And then guest today, Jim Watson is a guest of mine. He reached out to us online, was interested in Rotary. Were you Rotarian before, Jim? Yeah. Okay, so first time. We're glad to have you here. Hope to see you again, but thanks for being here. Welcome as our guest. Hey, Tom. Good to see you. I hope that picture's okay. I got it offline. Okay, looks good to us. We're glad to have you here. Appreciate all the insights you'll share with us today and all that you guys are doing in our community. So excited to have you here. Next week, so I want to thank Cliff. Cliff has been helping us a little bit since Beth hasn't been feeling too good and getting some speakers. And he got Raven Burke, PhD from Calhoun Community College, to come speak to us about Alabama politics, the good, the bad, and the ugly. So that should be a very interesting speak next week. And we've got a lot of great speakers lined up that we're just working on getting the right kind of dates that fit for everybody. But some great topics and great speakers coming. So excited about that. Ramp build. Pete is here today to talk about a ramp build. It will be this Saturday. There's some details for you guys on days and times and addresses, and we'll let Pete speak to that.
Okay, the hat's on, so you know what that means. It's ramp build time again. This one is a 30-footer, and it's just, it's located in the area off of Oakwood as you go just toward Chapman Mountain area. It's on Rosalie Ridge Drive, and it's 1906 Rosalie Ridge Drive Northeast. So with that, that's the build on Saturday. We have a pre-build tonight, and I'm pleading. We had some people that signed up, they can't make it. We're down to a very small crew. We could help, even if you could come for just an hour or so, just please, we do need some help tonight. So that's at 5 to 7, and we usually get out early once we get our tasks done, which is basically build what we need to build for our ramp build. So if you can make it, please come tonight. And that is 1320 Grace Street is where the Casa warehouse is. And then we'll load up on Friday at noon, and start the build on Saturday at 8 o'clock. As it is, it's a fairly simple L-shaped ramp, 30 feet. Half of it is on cement, so we won't be pounding on those. We'll be tap conning a little bit. The other half is off in the grass. I know it's going to be cold, so dress warm, okay? But please, we got a pretty good crew that have signed up for Saturday. Where I'm really hurting is tonight. So if you can make it tonight, that would really be a big help, okay? Thank you.
Pete, can you say the address again?
Address again?
Yes.
Okay. 1906 Rosalie, that's R-O-S-A-L-I-E.
No, for tonight.
Oh, I'm sorry, tonight. Casa Warehouse is 1320 Grace Street. Grace Street.
Okay.
That's right off of Oakwood. Okay, all right, thank you.
Thank you, Pete. We're talking about the ramp build earlier today, and I'd much rather take the cold than the rain, so I'm in. I will be there Saturday for sure. If I can make it tonight, I'll do my best. Thank you for coordinating that. Bring the whole thing for your sessions. Gonna get your picture up there, a lot, it looks like. All right, Betters Memorial Cleaning, we talked about January 29th. I did change that 6 to a 9, guys. I did it the last minute today. I didn't want to get, made fun of again today. 9 o'clock, Reed, do you have any insights on that for us? I'd show up and work hard?
Yeah, we sure could use some help. Sometimes we get 2 Rotarians, sometimes we get 20 Rotarians. So if you feel like giving back to your community and helping out Service Above Self, we would love to see you on January 29th.
Well, we got Alex. We're going to give him 2 buckets. We decided to make him work hard. Alex, thanks for coming. We appreciate it. Reed, thanks for organizing this. All right, we're going to do a little new initiative here. January is National Blood Donation Month. Mary Edgecombe is pushing this initiative for us and coordinating it. There's national shortage of blood, and we're asking for Rotarians to give blood over the next month. Marcia?
So on the radio, the Red Cross is doing a giveaway. You give blood between now and the end of the month, you're registered for 2 Super Bowl tickets, airfare, hotels, $500 gift.
Wow, this is Red Cross?
Some sort of special VIP tailgate party.
Okay.
And
So if you all online didn't hear that, but the Red Cross is entering you for 2 tickets to the Super Bowl plus VIP, party, airfare, all of that. And you need to give blood by the end of January. Is that correct? Okay. Which I'm in trouble. I already gave blood in December, so I got to wait 8 weeks before I can do that. So I can't participate. But we also, you don't have to? Okay, I'll give it anyway. That's fine. But I don't know if that would be the truth when they ask me on the question, has it been 8 weeks since you gave blood, right? All right. But we do have a Rotarian that's going to donate $5 to our foundation for every Rotarian that gives blood over the next month. So if you do, let us know, and we'll collect those funds and give them to the foundation. We also are going to we'll have the slides out next week. We're going to do February First Stop month. So you guys know every year we typically try to help out First Stop, especially with jackets this time of year. But we're going to have a unique need that they have each week. So look for an email coming out on that each week in February, we're going to ask you to bring items such as toiletries, jackets, that sort of thing. And we'll have a focus for each week in the month of February. So that will be coming out in email over the next week and will be on our slides as well. So keep an eye out for that. Please remember our new membership option, the Flex member. Right now, we are getting the board approval to update our bylaws. Once we do that, probably by next week, we'll have the vote here to approve that as membership. And then we will send out all the details with membership applications to continue to grow our club and impact our community in amazing ways. New member applications are going on the website this week. Justin and I had a great call this week, and there's a lot of stuff being added to our website, so keep an eye out for that. We still, I believe, Roger, we still have some Uganda scholarships open. So please see Roger or Todd with that if you're interested. Do you know how many girls we're looking at needing support for? Okay. Half dozen or so, 12? Okay, great. And then board positions for next year, please reach out to Jim TV-Paul. We could use some more folks on the board that are helping us, continue all this amazing work in our communities. Did I miss any announcements? Okay, I'm excited to ask Karen to come up here and introduce our guest speaker today. It's nice to have you back on the club, Karen. Come on up.
So today's speaker is my boss, Jeremy Blair. I met him for the first time when I was still at Hudson Alpha. He and the predecessor as CEO came out for a tour at Hudson Alpha. We talked about psychiatric research that we were doing over there, and they later took us on a tour of everything going on at Wellstone, which was so much and is so much. And I continue to be floored by all of the programs and services. I joined Wellstone in August of 2021. And I am happy to introduce you to Jeremy Blair, who is a licensed family and marriage therapist by training, but is a business guy and administrator by now.
Thank you, Karen, Chris. It's an honor to be here. Appreciate the opportunity to come and talk to you about Wellstone. Kind of talk to you about three things really: the state of mental health in the country and in Alabama right now, as well as an overview of Wellstone and what we're doing. And then kind of our big thing is the Crisis Diversion Center that you may or may not see going up on the parkway there next to our main campus. So if there's a silver lining at all in all of this pandemic fun we've been through in the last 2 years, I think it's highlighted the need for good mental health treatment, and that all of us experience good and bad mental health over our lifetime. Because the pandemic has really shown a light on, the need for mental health treatment, and the effects of isolation and all the other things that we've been going through over the last 2 years. And so just to kind of throw out a few stats, it's kind of, if you remember Sports Center's the Did You Know? So did you know that there was an estimated 100,000 overdose deaths in the United States last year? And that was a 28.5% increase. In Madison County, we average 77 overdoses a month. So let that sink in a little bit. And those are the ones that are reported and the ones that HIMSI respond to. There were 47,500 suicides with 1.38 million attempts for data that was most available, which is 2019. And that's in the country. Suicide is the 10th leading cause of death among adults in the US. And in 19, there were 804 completed suicides in Alabama. And then suicide is the second leading cause of death for children ages 10 to 14, and the third leading cause of death for children ages 15 to 24. So I know those are not feel-good statistics, but that is the reality of mental health in our country and in our state and in our community. And so Wellstone has existed for 50 years, a little over 50 years now. You may remember us as the Madison County Mental Health Center. That was a real catchy name, but in 2014, we changed that to Wellstone Behavioral Health. And then in 2017, we merged with another mental health center in Coleman, and we dropped the behavioral health at that point. It just kind of became Wellstone. We operate 66 different programs in those two counties. We serve it varies. In the pandemic, pre-pandemic, we were serving about 14,000 clients a year. During the pandemic, it's actually lowered to about 11 to 12,000. The reason why it's lowered is workforce. On any given month, we have about a 12% vacancy rate. And so for us, we employ about 425 employees. And so, we have about 50 to 54 openings every month. And so it's always a scramble our HR department stays busy hiring folks. The problem is they leak out the back door. And so I think this last month, we just had a board meeting yesterday. I think 24 new hires in the last 30 days, and then we had 11 separations. So we're gaining. We're not exactly, it's not one for one, so that's good news. And I think what I would consider the great reshuffle, I don't think it's the great resignation. I think it's more the great reshuffling, it definitely affects mental health. A lot of that happens because of, you look at the mental health salaries across the board, they're lower than a lot of different salaries in a lot of different areas. But we're continuing to try to make progress in those areas as well with our legislators down in Montgomery, kind of keep moving forward. We have really over the last 4 or 5 years brought on a lot of different programs with Wellstone. One of the areas that you may or may not heard about is our co-responder program. And what that means is we've got 2 or 3 now master's level mental health clinicians that pair with Huntsville Police Department officers, riding in the car with them on shift and responding to mental health crises. And so that's a program that started, the city funds those positions for us, and started back in the summer of 21. And so far they've gone on about 200 calls where they are intervening. And so what I remind our folks of is that prevention never makes the headlines. And so there are a lot of instances that have been prevented that you will never hear about as a community, and that's a good thing. But I do want to give you just 2 examples of those cases where our employee was called out along with an HPD officer. First one was a mentally ill woman who was at her apartment and was threatening to burn the apartment complex down. She had accelerant and gasoline and matches and everything that she needed to make that happen, she had in her possession. And the police officer came on the scene, secured the scene, and then our mental health counselor came in and talked with her, was able to convince her to go to the hospital and to get treatment, and was able to avoid really what could have been a disastrous situation. The other good part of that story is that lady didn't go to jail because before this program, their choice was jail or the hospital. And on a case like that, they probably would have just sent them to jail. And which, would have done really nothing in terms of treatment and getting that person help. And 30 days later, or whenever she got out of jail, would have been right back into the same situation. So you can kind of tell what the impact of that program is having. The other case is there was a lady that was parked up on a cliff in town and was contemplating hitting the accelerator and just going off the cliff. And police were called, the officer responded along with our mental health therapist. The therapist was able to talk with her, find out what was going on, found out a whole bunch of life stressors that individual was currently experiencing, and which is what brought her to that point. And as a part of that, was able to talk her into voluntarily going to our crisis diversion center, where she was able to get the help that she needed, get on some medication, and have follow-up treatment. So those are just 2 examples of the impact that program has had in a short amount of time, honestly. 6 months, and we've already saved those are 2 lives that were saved, honestly. There's countless others out of those 200 calls. Not all of those were life and death, but it's surprisingly to me how many are. How many of those 200 calls are suicide calls? How many are calls where people are intent on hurting themselves or others? And so I think the message there is there's a lot of people in our community that are hurting. And we need to make sure that we're linking them with the resources that they need at that time that they're hurting, and not just ship them to the hospital or ship them to jail. So I'm really proud of that program. It's honestly way exceeded my expectations. I knew it was a good program. I knew it would make a difference, but the fact that these kind of stories and the data that we're producing already in 6 months is pretty impressive. I want to read to you 2 quotes from 2 of the officers that participated in the program with our staff. If you know HPD officers or any police officer, They're a tough bunch to win over, and they're not always impressed with what you put on paper. And so the first quote is, having a partnership with Wellstone co-responders has been an amazing tool for officers to use. With the increase of mental health crises, having specialists in the field with us has helped better the community by giving people going through mental health crisis the help they need for their well-being and community safety. Having this partnership has helped me personally in day-to-day situations by giving more knowledge on how to deal with those who have mental illness and alleviating jail time for those who benefit from the mental health interventions. And then the other quote is kind of one of my favorites because it's pretty honest. At the onset of the partnership between the Huntsville Police Department and Wellstone, many police officers were unsure and skeptical about how this new partnership would work. Police officers will always be unwilling to change until said change starts to yield positive results that make sense to the officers utilizing and implementing the change, which is a totally fair quote when you think about what they have to go through from time to time. And he continues, since this co-responder program came aboard, there's been an overwhelmingly positive response, and most importantly, the fundamental skill set they bring to calls involving the mentally ill. Their calm demeanor on calls helps the officers on the scene build rapport with individuals in crisis and expedites the care they need to bring them back to a place of stability. Ms. Mitchell, who's our employee, along with the Wellstone facility, has established itself as a viable critical resource here in the Huntsville Police Department. So, those are kind of things that this is why we do what we do. It's why we get up every morning. We deal with seemingly crisis after crisis, because we want to make a difference in our community. And, a few years ago, we knew that there was a significant gap in making that difference. I talked about whenever somebody's in a mental health crisis, previously, when police officers who are the primary responders, at least right now, when people are in mental health crisis, they're going to be the first on the scene. HMZ's not going to come in until that scene is secure, and neither is anyone else. And so, but when the officers got there, they assessed it, figured out this is a mental health emergency. They had two options: go to the hospital or take them to jail. They take them to the hospital. They have to stay there until the personnel at the hospital clears that individual. Well, depending on what's going on in the emergency room that night, that could take anywhere from 1 to 6, 7 hours. And that whole time, that police officer has to sit there and wait on that to be cleared. And then jail, it's still a process. You don't just drop somebody off and go out on your way. There's still a process there. But we also know that's not always the most appropriate way for someone to get help who's in a mental health crisis. We recognized that and started working with the Commissioner of Mental Health in Montgomery, as well as legislators, to bring about a concept called the Crisis Diversion Center. And that diversion center is what we like to call the third option for those who are in a mental health crisis. So this is what you see on the screen is the architect's rendering of what's being built on the Parkway. And that facility will have 16 inpatient beds for adults, and then also 15 what we call temporary observation beds. So the inpatient beds are up to 7-day stay. The temporary observation beds are 24 hours or less. So sometimes people come in and just need a few things, and that'll get them back out on the streets, back home to their family. Sometimes they just need to dry out. This will take those who are drunk or public nuisance and those kind of things. And then others need a little bit longer to stabilize. Maybe they've never had mental health meds, never encountered any kind of mental health treatment. And so it's going to take longer than 24 hours to stabilize. But this facility will be equipped to deal with any of those types of individuals. There'll be a dedicated sally port in the back of the building for law enforcement and HMZ to drop those individuals off. So they're not being brought through the front door by the police. They're having a safe and secure and confidential entrance in the back. And, we see this as what we've called the game changer for the community. So in 2020, Governor Ivey awarded 3 of these crisis diversion centers in the state. So one's here, one's in Montgomery, and one's in Mobile. We're the only ones that are building a new facility. Mobile had an existing building that they kind of retrofitted. Montgomery bought an existing building and they're retrofitting. So we're kind of proud that this building is built specifically for this purpose. So it's designed and laid out. We visited at ad nauseum, Georgia, Tennessee, and Arizona, and looked at their facilities. Because the crisis diversion building is not a new concept necessarily, it's new to Alabama. And so we went, I believe, if there's somebody else that's doing it, go see how they're doing it, learn from them, learn from what they would do differently. And so we took all of those lessons and went into designing this facility. We're really excited. We broke ground last year. It's scheduled to be open in the May, 1st of June of this year. I will tell you that building a 25,000 square foot building in the middle of COVID with all the logistical challenges that it presents has not been fun, but it has been well worth it. And so we're excited about what this will bring to the community. You can kind of tell through those 2 stories I mentioned earlier, how it's already playing a part. We have some temporary operations that are in some other buildings that we own. And so it's already up and going. It's specifically for law enforcement. And so the benefit to law enforcement that they have already seen, as the quote said, you can tell us all day long, but let me experience it. For them, I mentioned earlier, the hospital, they go drop somebody off, it can be 1 to 7 hours. Our average drop-off time right now is about 10 minutes. And so the goal, that's always been the goal, is 15 minutes or less. They come in, they tell us what's going on, we do what we need to do, and then get them back on the streets. Because we want our police officers concentrated on public safety. And they can't do that if they're sitting in a waiting room somewhere. So we're excited about what that impact has already been on our police officers. It's open to not just HPD, but Madison Police as well as Madison County Sheriff's Office, and all 3 are referring and bringing folks to us. The temporary facility has 10 beds and they stay full. And so we anticipate when we open the new building, we'll be pretty busy. But we're excited about what this will mean for the community, and being able to free up the ER, especially. This was all conceived pre-pandemic, and we knew that we needed this. But now with the pandemic among us, we need it even more, because the impact of the pandemic on our mental health, the impact of the pandemic on our ERs, if we can divert those that are in a mental health crisis away from the ERs and into this specialized facility, then it's a win-win for everybody. And so Huntsville Hospital is very supportive of this, and we appreciate our partnership with them. But there's still one piece missing even of this. And so we don't ever stop. We keep going and try to figure out how do we bring other resources. So under the did you know that there is currently no inpatient option for children and adolescents in Madison County. And so currently HIMSI transports 800 kids and adolescents out of our county every year for inpatient mental health treatment. A lot of those, the closest is Decatur at Decatur West Hospital. But because Decatur is the only facility in all of North Alabama for children and adolescents, you can imagine those 16 beds stay pretty full. And so oftentimes those HIMSI wagons are getting diverted to Birmingham and taking kids to Children's Hospital. And then there are even been times that Children's is full and they're taking kids down to Dothan and Mobile. So those HIMSI buses are out of circulation in Madison County for sometimes up to 12 and 14 hours while they're transporting kids for psych treatment. So we knew when we built this building that one day we wanted to put a children and adolescent unit on that same site. And so we, in part of the master plan, set aside some land for that children and adolescent wing. And so we'll continue to work on that. And continue to try to get that support in Montgomery to build it, not only fund the building, but also the operations. So the adult side is about a $7 million operation. The children's side will be about a $3 million operation. So you're looking at a $10 million operation there. And the current building is 25,000 square feet. We've started the design process now with our architects for the children's wings. We just go out on faith and hope, and we'll figure it out. But it'll probably be another 15,000 square feet for that section. So you're looking at roughly a 40,000 square foot building that is sole purpose is for those in a mental health crisis to seek that, get the help that they need. More importantly, it's not just that crisis at that moment. That program is designed to follow up and link people with care after they get discharged. And so the good thing I mentioned that Wellstone has 66 different programs. We have a very robust continuum of care. So no matter where you are and what services you need, we most likely have those services available, whether it's outpatient or medical. We have psychiatrists and nurse practitioners on staff. So if you need medications, we have a pharmacy on site. So those medications don't have to travel. Our population doesn't always go transportation. They rely on public transportation or taxis or friends. And so the more that we can have in one location, the better we're going to be able to serve our clients. So that, I don't know if you've ever done the poverty simulation, but it will open your eyes to the challenges that those who have less really endure getting even basic services. And so our mission at Wellstone is to make sure that we're attending to the mental health and substance abuse needs of our community. Our primary population is Medicaid, as well as Medicare and self-pays. So those that don't have the ability to pay. We don't ever turn anybody away because they don't have the co-pays. We're going to serve them because that's part of our mission. And so we provide about $3.5 million a year in uncompensated care. And when you think about an overall budget of about 30, that represents, what's that? I don't know what percentage that is. I'm not good at math. That's why I'm in psychology. But it's a significant amount. And if we had $3.5 million in that revenue, we could raise our salaries of our employees and really make sure we're taking care of the folks who take care of the community. So that's another area where we are trying to get our legislators' attention, because a lot of people think we are a state agency. We are not. So when the governor announces a 4% cost of living raise for state employees, that does not apply to us. So we're not a state agency, and we have contracts with the state, but 60% of our revenue comes through insurance billing. And so when that person that comes through our door, which is the fastest growing population is those who don't have any insurance, we know that we're going to provide that service for $10 or so, and it costs us $100 to deliver it. And so that's not a sustainable business model by any means. The other area for us, when you kind of look in the future that we're keeping an eye on, is housing. Affordable housing in our community for our population is becoming an increasing, alarming problem. We're starting to get stories of our clients that are getting notices that either their rent is going up or that their leases are terminating because they can raise the rent and get construction workers and other folks come in and get higher rents. So that is something that's on our radar for sure. We don't want to be in the housing business by any means, but if we may not have a choice in the future, because there's not a lot of incentive for people to build affordable housing, which is understandable. But I have the advantage of, I don't care if it makes money, I just need to break even. And so if I can break even on apartments and be able to provide housing to our clients and our individuals, then it's a viable business opportunity for us. Yes, sir.
How many beds will this 25,000 square foot facility have? They should have mentioned earlier.
It'll have 16 beds on the 7-day unit, and we're building it for up to a capacity of 24 beds. And then the temporary operation unit will have 15. So we'll effectively double the number of inpatient psych beds in the county. Because the only other resource is Huntsville Hospital's, what we call a third floor at Huntsville Hospital, and they're about 32 beds. So as we kind of continue in our wrap up, we're excited about the future. Legislators for a long time did not invest in mental health. And in fact, they cut, back in the 08-09 recession, they cut about 40 million out of the community providers budget. And that never really came back. It still hasn't technically come back. The money that has been pumped in has been for new programs, which we're definitely grateful for. We definitely need them. But there also are existing programs that haven't had increase in funding in about 20 years. And so that's part of the challenges that we'll continue to work on in Montgomery. That's a Montgomery issue, not necessarily a Madison County issue, but it affects Madison County. And so we'll continue to work on that. But we're just thrilled to be a part of this community, to be able to grow and provide the services that we need here. What I tell the mayor and his staff is, as a part of a growing community, we definitely got to continue to keep up our physical infrastructure. That's how we meet that demand. But as we continue to grow, our social service infrastructure also has to be kept up. And so whether that is with First Stop and our homeless initiatives, whether that is through Wellstone, what we're doing, and the other nonprofits that are taking care of some of those social services infrastructure, those don't need to be left behind. Because if you want a thriving community, you've got to make sure all parts of the community are thriving. And so you don't want to end up in like some other cities that I won't name, but have a lot of issues now that they grew and they neglected the social services infrastructure while they focus on the physical infrastructure. And they are now reaping those consequences and trying to figure out, they'll end up costing them way more in the long run to address them now than if they would address them early on. So again, thank you for having me. Appreciate the opportunity. Karen would not let me get away without saying that, this building is a $10 million project for us, which is a huge project for us on our scale. I've raised $3 million of that, or no, 5 million, I guess. 5 million of that 10 million. 3 million came from the state, 1 million came from Madison County Commission, 1 million came from the city of Huntsville, and then Madison City also kicked in a little bit. And so, but part of Karen's job and her responsibility is to raise the other 5 million. And so she has launched the Be the Rock campaign. And so I think you've got some of that on your table. So if you want more information about that, whether it's for you or your companies or your community, please see Karen and reach out to her because we would love to have you as a part of our donor family. So, stop, and any questions? Yes, sir.
Jeremy, I want to make a comment. Thank you for partnering with us at First Stop, because as most of you know, that a large number of the homeless population does have a mental problem, and being able to refer people to you for that help has really been helpful. So thank you for that. The other kudo I want to give to folks who don't really realize it, the city of Huntsville is very, very supportive of what you do, what we do. And I think they do recognize that coming in early and trying to get involved and have help people that need this kind of support is going to help our city greatly. So,
I agree. Yeah. Huntsville City is traditionally, I think they have given us about $800,000 a year in funding. And then this last go around increased that for those co-responders and So we're up to a little over 900,000. So you're right. Huntsville City, Madison County, Madison City, they've all been, we are the envy of my colleagues in other communities in this state in terms of the local support that we get. You know, there are some community mental health centers that if they get $5,000 from their local government, they're shocked. And so we are definitely lucky the local support that we have.
You shared some sobering numbers about mental health, but they were from 2018. So first question is, why does it take so long to get the numbers? And what do you expect 2020 to look like?
So welcome to government. On the numbers. You know, the 2020 suicide number among adolescent boys, it increased the preliminary data. I don't know what their process is, but I think it has to go through, like, any of you guys that are been federal contractors understand the pain. But the preliminary data is that suicides among the teenage boys has increased 20%. And so overall, the data is it's gone down a little bit in terms of suicide rate, which is a little weird when you kind of consider, and that was for 21. The overdoses, though, have skyrocketed during the pandemic. That is the piece and that data on the overdoses was last year. So for whatever reason, you can get pretty current overdose, but you can't on the other as much on the suicide. Yes, sir.
I'm very pleased to hear that you're successfully partnering with the city and the police department. I'm curious about some other organizations that seem like they would play with some of the same people that you're working with.
Mm-hmm.
And that would be the Children's Advocacy Center and the Huntsville Hospital. You said they have beds, but
right.
Are they cooperative with you guys and how does that work?
Yeah. So we actually have a program with Child Advocacy Center that we operate in tandem with them. They provide two therapists. We provide two therapists for a specialized group. It's called the Problematic Sexual Behavior Group. And so those are kids who are displaying some problematic sexual behaviors. And so once those are identified, usually by the Child Advocacy Center, then they're put into a special group with the goal of changing that trajectory of those behaviors. So Chris and I are good friends, and so we work well with each other. On the Huntsville Hospital side, yes, we work very well with them. Everybody that comes on the third floor that then goes to Drake Barger's court, probate court, and then gets committed, comes to our facility. So we run a 16-bed inpatient facility for those that are civilly committed. That's, I guess, one of the other misnomers that are out there is we closed all the state hospitals. What we did, we closed North Alabama Regional Hospital, which was kind of the hospital for our area, back in 2014. But what people don't know is we opened four 16-bed facilities to take the place of that state hospital. And so basically what the state did was switch that responsibility from the state to us. And the good part of that is we're in the community. And so those individuals that are from Madison County stay in Madison County. They're not going to Decatur.
Well, are those 16 beds going to be part of this facility or are they still standalone?
It's standalone. It's separate. So it's in a separate facility and it's been operating since 2014.
Wanted to confirm that they are.
We're not double counting. We're increasing them for sure.
Where is this on Parkway?
Well, that address is going to be 4020, but our main location is 4040. So Golf and the Parkway, you know where Torch is. So right across the street from Torch, on that side of the road, is where our main campus is. So the main building it's the old Nichols Research Building, is the main adult campus. Right next to that is the children's outpatient building. And then to the right, so in between the old Nichols and the old, I don't know what the other building up on the hill was, but it's still there. But it's in between those two buildings. We had the lot in between. Yes, sir.
We have two questions. First, profit or nonprofit?
Nonprofit. We're a public nonprofit, and so our board is publicly appointed. the city council of Huntsville, the county commission, in Huntsville.
And the second question, what is the state's responsibility for caring for mentally ill patients in the state? How do they execute?
Yeah, so, by statute, they are responsible for those who are civilly committed. And that's technically where the statute ends. But they obviously have expanded that to the community mental health centers and all of those types of things. The state now just pretty much operates Bryce Hospital in Tuscaloosa for the civilly committed, and then Taylor Hardin, which is for forensics. So those who are found not guilty by reason of insanity, instead of going to prison, they go to Taylor Hardin. And that's it. So and then Harper, which is a geriatric facility. So those who are over 65 that have severe mental health issues go to Harper. So those are all located in Tuscaloosa. And so those are the only 3 inpatient units they run for mental health. Everything else, they contract with community mental health centers to operate. And then they oversee us. They license us. We have standards that they produce a 235-page manual on, and then come every year or 2 years and audit us. So they're more of an auditing body and standards provisions and a contract work. Yes, sir.
Mr. Blair.
Yeah.
Rudy Chavez, Hispanic coordinator for St. Vincent de Paul.
Mm-hmm.
I also attend the North Alabama Mental Health Coalition.
Yes.
Meetings.
Yep.
And to answer your question, the meeting is full of supporters from all the city, wonderful supporters. Really had a good question about the beds.
Mm-hmm.
And you also mentioned about children. They're not including the children. So in that meeting, I met a young lady. She's an attorney for foster children and children in need. So I asked her to come to our club and represent, because we have several members in our club that deal with children in need. I don't know if you know this, but Morgan Gillette is a member of this club.
Yep.
And he was pretty much the starter of the North Alabama Mental Health Coalition program.
Yep.
To support some of these programs that you talked about.
Mm-hmm.
To keep the innocent out of jail and bring in the police department, the city, and the medical community, and all those other supporters to keep the families. Thank you so much for your work. Morgan Gillette was sending this, but he was a member of our club.
Morgan was a giant. I think a lot of Morgan. Met him, goodness gracious, 2015, maybe. And you're right, Morgan, it should be credited with a lot of the progress that's made today were from the seeds that Morgan planted many, many years ago. And we appreciate his service, setting a lot of meetings with Morgan and Mac Yates, and appreciate the work that they've done. You know, Morgan was instrumental in getting our jail diversion program up and going. I have to mention that. Again, there's 66 programs, so I'm not going to mention all of them. We'll be here till dinner. But the jail diversion program has case managers that go into the jail, identify people with mental health issues, and work to get them out and then connect with treatment. The reason for that is someone with a mental illness typically stays 6 to 9 months longer in jail than someone who does not, simply because they can't navigate the system. And so Morgan and Max saw that, and wanted to work on correcting that. And so we now have 4 case managers. We started off with 1. That was with the city, county. We got Speaker McCutcheon on board. He funded a position. Now the Department of Health. They were kind of late to the party, but they will take all the credit. But they now fund them. So we have 4 that are case managers that are going into those jails, getting folks out. They have a caseload of 95 individuals that they regularly work with. And so you can imagine the impact it's had on those 95 lives. So thank you for mentioning that. All right, thank you.
Very sobering, but I think it's a message we really need to hear. We need to continue to push our leaders the county and the city just to support these efforts for sure. Rudy, thanks for bringing up Morgan. That was awesome to make that connection. I really appreciate that. Any other questions or comments that I missed for today, guys? All right, well, if you'd stand with me, we'll finish with the four-way test. Right, all the things we think, say, or do. First. Second. Third. And fourth. Thank you for being here today. Thank you for being Rotarians. Have a great day.
Okay. But I won't, I'll just handle it.